Hi, I'm Renata Lutz. I'm 42 years old. I'm a mom of two little boys. I'm an ovarian cancer survivor. I had my boys post ovarian cancer, and I am a photographer. I always wanted to be a mom. That was something that was like something that I really wanted in my life. When I was 30 years old, I had just finished my PhD in cell biology. I was moving to the United States from my original country of Brazil, and I went to do just a regular checkup with my OBGYN, and they found a cyst. They found a vascularized cyst on my left ovary at the point that I was just like a few days from moving. So my doctor said, you know what, just move, start your job. I came to the United States for a science job at the time. Um, and she said, make sure you get a consultation when you get there with the doctor there. So I did. If you asked me at the time if I had any ovarian cancer symptoms, I would say I did not. But looking back on the years prior to this, I had bloating, I had explosive diarrhea, I had abdominal pain. I had been to a gastroenterologist because I did believe I had some kind of gluten or lactose intolerance, and it was not diagnosed at the time. The doctors never ever thought about ovarian cancer. So when I went to the doctor here, he told me, you know what? Even though if this is nothing, it's just a benign cyst, I do recommend you take it out ASAP because it was 7 centimeters at the time and it could create like a torsion on my ovary, and that would be an acute abdomen emergency. And he's like, you don't want to go through emergency surgery. So I decided to schedule surgery. I, at the time, went back to Brazil because that's the doctor that I really trust. And during the surgery, although like all my exams were coming out as normal, it just seems like a benign cyst. During the surgery, there was a gynecologist oncologist present, and both her and my doctor thought it looked very unusual. So they decided to take it out. They took out also my left ovary, and it went to pathology, and then a week later it came as a granulosa cell tumor of the ovary. So it was a big shock at the time. I was newlywed. Um, I, of course, was planning and having a family, and it was a big emotional, like, roller coaster. Although I was in science, I'm a pharmacist by training, although right now I'm a photographer, but um, I just went home and by myself, I just went through like all those medical journals, and really the only question that I had in my mind is like, will I be alive in 5 years? And that was pretty, it was a pretty shocking news. It came with a lot of uh, emotional distress. And yeah, so that took my life into like perspective. What's now? So when I went to the gastroenterologist for the only time, I discussed that I had these episodes and they would happen at night, and it was very weird because I had a suspicion it could be lactose intolerance because sometimes I would eat pizza and it would cause this massive abdominal pain, that it was like really hard to go through, and then it would turn into like diarrhea. So I was like, maybe it's lactose, but then the other day I would do something with cheese and nothing would happen. Um, and then what we did was a lactose curve. It's just like a blood test. You drink a bunch, like a liquid that is very heavy in lactose, and then they draw your blood from time to time and see how your your body is degrading that. And I was very, very borderline, like maybe sensitive, not even. Then it was suggested to me to do a biopsy of the intestines to see if it could be something else that I ended up not doing. But in no way or form ovarian cancer was brought in. And as a matter of fact, after going through this, I'm today part of an ovarian Cancer Alliance of San Diego. And I'm also part of a program from the National Ovarian Cancer Alliance. And we have a program that is called Survivors Teaching Students. And that program is actually the whole purpose is for us as survivor to go into medical students and into nursing students and tell them, like, if a woman comes in with bloating, abdominal pain, diarrhea, constipation, feeling full, even though they didn't eat a lot, they can't tolerate a lot of food, to please do not dismiss this women, because, yes, I would say 100% of us in the alliance at some point got dismissed by some medical professional as, you know what, you're a woman, being bloated is normal, having abdominal pain is normal. And we always say to other women to just advocate for yourself. What is normal for one person, if you know it's not normal for you, then it's not normal at all. And that's part of the work that I got passionate about. It is just like telling other women that, if you feel something is off with your body, it's probably off with your body. So I feel that during my journey, I got dismissed twice. The first time was like the gastroenterologist it was not something that was even on his radar. I don't know if it's because he was so focused on his specialty. And the second time was I actually had a recurrence 4 years after my original tumor. And at that time, when I had the recurrence, I was laying on a hotel bed, and I touched my abdomen and I felt a ball, like the size of a golf ball. And at that point, like, subconsciously, I knew what it was. So it took me a few days to call the doctor, because all these crazy thoughts come into your mind, right? Of granulosa cell tumors are usually very slow growing. People have recurrence many years after the original tumor, sometimes 10, sometimes 20 years. So here I am, 4 years later, I have another abdomen mass. So it took me a few days to get the courage to actually call in. And I called in and I told the front desk person, I said, I have a ball on my abdomen wall that I can feel from the outside. I need to see the doctor. And that was my gynecologist's office at the time. And she told me, oh, no, you need to see your primary care. And I said, no, I had ovarian cancer 4 years ago. I would really like to see my gynecologist. And then she's like, just a second, I'm going to talk to the doctor. So she comes back. She's like, no, he said you need to go to your primary care. And I said, at the time, I didn't even have a primary care. I'm like, I don't even have a primary care. And she's like, oh, you can call this number. And then I went on my own, and I was very lucky to find someone that is still on my care today. She was very attentive. She immediately passed me to another gynecologist who is married to oncologist, and she's like, just go to that office and they will take care of you. And I've been having the best care I could ever think from that point on. But being dismissed is not like it's not exclusive to my story. Unfortunately, a lot of us survivors at some point got even to the emergency with pain, and then just got sent home. So it's pretty discouraging. You know something is wrong. You don't have the knowledge to tell what is wrong. Honestly, you feel it's wrong. Is not. Then you start second guessing yourself. A lot of us got sent home with gay sex and say it's just bloating. Just take this over the counter and you'll be fine. Or I don't know, some kind of constipation medication, and just to find out sometimes years later at a more uh, advanced stage of cancer that it was ovarian cancer. I was not staged at the time. They thought it was stage 1. I didn't have any cancer on my tubes, only on that ovary. So for granulosa cell tumor, it's 1% of all ovarian cancer. Is a very, very rare cancer on a rare cancer. And it's a slow growing, is known to be like a slower growing, it's not super aggressive. So the treatment for that type of tumor is surgery. So I had 3 surgeries throughout my life to remove it. And the agreement with my gynecologist oncologist is that we're going to do surgery for as long as needed, because there's not, for being such a rare type of tumor, there's not a lot of big studies on how chemotherapy would work. Or so we agreed that at this point, since I have no evidence of disease, that's all we're going to do. And yeah, but I had an appointment with a radiologist that was also like something that my oncologist said, if you want to explore and have like an appointment and having a conversation. And at the time, it was not even an option. He's like, it's like on your abdomen. It's not very localized. He's like, I'm not going to radiate your entire abdomen. So it was, the first 2 surgeries were laparoscopy, so it was video. So those were not very hard to recover. The third one, when I had the recurrence, and it was in my abdomen wall, then I had to remove part of my muscle on my abdomen wall, and that was a little bit like slower to recover. It was a regular like laparotomy, so it was an actual like open scar surgery, and they had to take a little bit of my abdominal wall from it. And my doctor, she kids with me that now I don't have a 6-pack, I have a 5-pack. So the moment that I discovered my recurrence, I was already trying to get pregnant for about, I'm gonna say, almost a year. I just didn't have periods at all. I stopped my birth control and I didn't have periods for almost a year. Um, we didn't know if it was because I was in birth control for so long in my life, because I started having like ovarian cysts when I was a teenager, just like functional cysts. Um, so we didn't know if it was because it was so long. And so when I had the recurrence, we were already trying to get pregnant, my husband and I. And when we found that I had the recurrence, we had the surgery, and then we had this conversation with my doctors. And both my oncologist and my regular gynecologist, they were very supportive in whatever like we wanted. There was not a lot of knowledge around what could happen. We really didn't have any clues on how pregnancy hormones would play out. So they were very supportive, but we knew we were going into some like uncharted territory on like, will this make me recur again? or not, but all of us, my family, my doctors were very confident that we could, that we would try at least to give us a family. The only person that was uh, the radiologist that I had an appointment when I mentioned to him that I wanted to have kids, he basically looked at me and say, "You're crazy because you're gonna die." Um, and I got out of that appointment like crying, like like, am I this crazy? Like, so it was a pretty like uncomfortable appointment where he basically made me feel like you're absolutely crazy because you're not going to be here to raise those kids. Because he thought it would reoccur again and again. Um, so that was one of the reasons that he didn't advise on uh, radiotherapy, because at that point I had like a recurrence on my abdomen wall, and he's like, "Well, I cannot radiate your entire abdomen. That would kill you." And then when I mentioned that I wanted to have kids, he was like, "You need to really think about it. Like, what if you're not here?" Um, so it was a pretty it was, yeah, it was probably the worst appointment I've ever had in my journey. But my other doctors were very supportive of us wanting to have kids. And in fact, a few months after my last surgery, I did get pregnant. And I ended up having a miscarriage at 8 weeks. But for us, although it's very emotional and sad to have a miscarriage, it was also that like little glimpse of hope that, my other ovary maybe was viable and maybe I could try again. And then it was very like mixed feelings, right? You get so excited when you get that positive test and you get a miscarriage, and that's very emotional. But then at the same time, we're like, wow, maybe this will happen for us. Like it went from I'm not having any periods and we've been trying for a year, and to like actually have something that was like, wow, maybe we have a chance. Uh, and then after a few months after that, I had another positive test, but immediately my period came. In about like a year after my last surgery, um, yeah, a year and a half, I got pregnant with my first baby. So, in terms of causes, we have no idea what could cause. Ovarian cancer is related to other cancers like colon cancer. So my grandma died from cancer when I was about like 7 years old, 8 years old, and nobody in my family can tell me exactly what it is. Um, so we don't know if I have a history in the family. I know I have a cousin that is going through breast cancer. Um, but I was never genetic tested, and we don't know the source of my grandma's cancer. So we don't know that family history. And I started birth control when I was about 14 years old, like right, probably a year after I had my period. I always had multiple functional cysts. So those little cysts that pops up and it did dissolve, and we do to this day monitor my cysts. I still have cysts on my other ovary. So we still monitor twice a year. I still do ultrasounds, and we still monitor those just to make sure it's not going to turn out into another granulosa cell tumor. I'm doing every 6 months my ultrasounds, and then I do a checkup with my oncologist once a year. But next year, I'm reaching my 10 year with no evidence of disease, which is very exciting.